Listen, do you have sufficient time to ask questions and get the answers that you need? And then the next thing is you want to really explore the experience of your surgeon and make sure that they have a wealth of experience with whatever procedure it is you need to have. So, you said that you're having some difficulty getting the kind of sharp vision you'd like with either contact lenses or your glasses. And it may be that if you do currently have a cataract, that's part of the problem. So I wouldn't necessarily blame your eye doctor for that. It may be that physiologically you have something that's limiting your vision. And then secondly, you just need to make sure that you've researched what other people tell you as far as references, and if they can point you to patients who have had that procedure done so that you can speak to them as well. So if you're comfortable with your doctor and you're able to have all those things fulfilled, then I think you're in the right place.
Thank you for calling in. Okay, well, thank you, Carol Ann. Dr. Beck, I have a question for you. How do you know, when do you decide when you should send a patient to for cataract surgery?
Well, when you, as the patient, I always say your daily activities are being interfered with and you're avoiding a lot of the things that you love to do, like reading. You don't go out at night anymore because nighttime driving's a problem. You're not reading like you used to because your eyes bother you. So when it starts to interfere with your regular activities, that for sure is a sign that something's changed and that you really want to look into it. It's important to have routine eye exams, and that way every year we can decide at that time when is the appropriate time for your cataracts to be removed and improve your vision. You'll have that discussion. If you are thinking about it or wondering if cataracts are right for you, you want to have that discussion with your eye care provider about the benefits and risks. And once it's determined that this is something that far outweighs any risk, then there's no reason at all why you shouldn't do it. And even younger people now are getting it done because of the advanced technology and the fact that people just want to see better and be free from their glasses or contacts. So when they're younger and healthier, they like to get it done. And one other thing, even if it's not interfering with your vision and you say, no, I see fine, if it starts to interfere for the doctor to be able to see inside your eye to treat or examine your eye for another reason, let's say you have macular degeneration, and we just can't see in to see, or diabetes, we just can't see in because that cataract is in the way, then even if you're not complaining, then it's very important as well to remove it.
Interesting. And what do your patients say after they have their cataract surgery?
They are so happy. A lot of them say, I don't know what I was so afraid of. I should have done this sooner. That's actually a big one. People tell me about how the colors change in their house, how they can now go out at night. It doesn't bother them to drive at night anymore. They're, things are brighter because when you get the new lens put in, colors are going to be a lot more bright because you're looking now through a clear window as opposed to your yellowish brownish lens that was there.
I had a patient just the other day who's an artist, and he was saying, all my friends kept saying how I was painting everything way too green, and I was arguing with them, and now I look at my paintings and I think, oh my goodness, they were too green, and it was really the cataract. It was the cataract that was distorting the colors.
It's been said that Monet had cataracts, and that's why he painted the way he did. Things are a lot more greenish and bluish, and they're kind of muted, the shades.
And why would it be green? Why would it be green?
Yeah, it really has to do with that fact that you're not perceiving blue wavelengths of light as well because the yellow filter is absorbing those. So they may be using a lot more of those blue-green pigments to have it look what they think is normal, but when you look at it, you're like, oh no, that isn't a real color.
That's so interesting.
Yeah.
If you'd like to ask a question, we'd love to hear from you. Our number is 361-4675. That's 361-4675. So if you have any questions about your eyes, Dr. Beck and Dr. McCabe would be delighted to answer your questions, and so you can be part of the show tonight. Dr. McCabe, I understand that today's cataract surgeon has lens implant choices for improving vision. And so can you tell us about the different types?
Sure. Yeah, that's one of the exciting things actually about being a cataract surgeon today. So it used to be when I first came out in practice We really just had a monofocal lens, a regular lens that would help to correct your distance vision, but not your astigmatism and not your near vision and not your intermediate vision. And so we would take out your cataract, we'd put an implant in, you'd have thinner glasses than you ever had before, but we weren't making you glasses free on a regular basis. And today we have ways of correcting astigmatism, your distance vision, so we can maximize that with lenses that correct particularly even large amounts of astigmatism, which allows for an improved quality of vision as well for those patients. Or we can give you something called a multifocal lens, which is a lens that gives you a full range of vision without glasses.
So reading glasses are incorporated into your eyeballs now, and
into your eyeballs themselves. You have them everywhere you go. You don't have to look for them on top of your head because they're in your eyeballs.
oh my gosh, isn't that amazing?
Yeah,
That
it really is a neat thing if you think about it. I mean, a lot of patients afterward, they're like, I've never been this free of glasses in my whole life. Or even if you went for, 40 years of your life and didn't need glasses until you needed readers, you still needed them then, and now you don't need them any longer. So it's a pretty exciting thing. I think I have like the best job in the world. Because
I was gonna say, it sounds like people are so happy when
They
you're finished
are.
with them so that they can see everything again. That's wonderful. Well, we're gonna take a break right now. We'll be right back, so stay tuned. And welcome back to Local Doctors on Call. I'm Wendy Mann-Resnick, and we're talking about cataracts tonight with Dr. Cathy McCabe and Dr. Susan Beck. So if you have a question, give us a call. The number is 361-4675. That's 361-4675. We'd love to hear from you. And so, Dr. McCabe, does the patient, we were talking about implants and how amazing they are and what a great job you have. So does the patient give input as to what kind of implants they want? I mean,
actually cataract surgery is one of those things where you have so much input as the patient because cataracts don't hurt the health of your eye in any way. So oftentimes I'll have a patient come in and say, well, I'm not seeing so well, but do I need cataract surgery? Tell me what to do. What kind of implant should I have? Should I even have my cataracts out? And unfortunately, this isn't one of those things where your doctor says, do this, do this, do this. You really have a lot of decision making to do because cataracts don't hurt you in any way. You can keep them as long as you want. They will gradually make you see worse and worse, but they don't hurt the health of your eye. So we talked a little earlier about when is it time for cataract surgery. So I tell patients, the good news is you don't have to have it out because it doesn't hurt the health of your eye. So the time to have cataract surgery is when you're bothered. Until then, there's no point because, it'll get gradually worse and you'll eventually be bothered. But once it's bothering you, taking it out cures you forever from cataracts. So once you're starting to have symptoms, that's the time to take it out.
so does it eventually lead to blindness, or it does not?
Yes, it does.
It does.
It's the leading cause of blindness in the world today. And it is completely curable. So that's just because there's so much of the population in the world that has no access actually to surgery. So we are so fortunate here that the minute a cataract bothers you, you can pretty much have it out and be cured of it forever, whereas a lot of the world, that's not the case. And they actually go blind just because they don't have access to that surgery.
And once you go blind from that, if you take the cataracts out, is it too late? Or?
No, it's not too late.
No.
You could still see better. So at
Wow.
any point along the way. So that's why, it's really fine for you to wait, but as soon as you're bothered, have it out so you can see better. So I'm sorry, I really segued there. You asked me
okay.
why would we choose one implant over another?
Yeah.
So yeah, so it is the patient that chooses the implant because we talk about what your goals and needs are. So if you're having cataract surgery and you say, glasses are a part of who I am, I wouldn't look the same without my glasses, I love my glasses, I want my glasses forever, that's not a problem. We can do that for you. We can give you a standard implant and you can use your glasses and that will be wonderful for you. But it is an opportunity for you to see better without glasses. And so that is what we talk about. What would you like? Would you like to see a distance without glasses? Would you like to see your computer better? Would you like to be able to read without your glasses? What are the things you do in your life? What are your activities? And then together we kind of pick from all the choices we have. And today we have so many different lenses actually. And they all have different characteristics. And used to be I'd say, well, we have 3 types and this is kind of what we'll do. But now we have more and more choices and it really can be tailored pretty much exactly to what your needs are and what the health of your eye is. Because a lot of times that choice is also guided by what the health of your eye is and what will actually work the best in your eye.
That's so interesting because I would have thought, you know, I'll have it all done and then I'll just wear clear glass if I'm, you know,
well, that I agree with too. You
While
can
you're
always
there.
elect to wear glasses. There's no, they don't have to have power in them. I had a patient one time for LASIK who asked me the same thing. They said, you know, I'm really, really nearsighted. I can only see this far without my glasses. Can you make it so that I can see pretty well at distance but still need glasses? I said, no, I can't. I can fix it so you see perfectly at distance and wear glasses with no power whenever you want.
So is that what they did?
Yeah. And they thought that was a great idea. They just hadn't thought of that.
Oh, that's funny. So Dr. Beck, do you recommend high-tech lenses for your patients?
I do. I let them know that it's available. I let them know that they have lots of options. In fact, everybody who I mentioned about cataract surgery too, they've heard a few words out there about laser cataract surgery, no blade cataract surgery, multifocal cataract surgery. Somebody they play tennis with has that type. So I let them know all the options. I tell them that, you know, you can have the standard kind that just fixes one vision. You could get one eye for far, one eye for near. You could get multifocal, and they're always very intrigued to know that these are newer options than what they'd heard about from their parents and their friends who maybe had this done even 5 years ago. So it's exciting, and you know.
It's amazing, the technology. And so is it difficult for, you know, all this new technology? What was the training for this? Was that difficult?
Well, you know what? That's another exciting part about being an ophthalmologist. I feel like I'm a recruiter or something, but it's a great field to be in because there are so many technological advances that are constantly going on. So it's not like, you know, I'm going to be doing the same thing my whole life and nothing exciting and new is ever going to happen. In fact, there's so much exciting and new all the time that I am constantly going myself, you know, not only to help lecture and educate, but to also be educated because there's constantly new things that we are having available to us. And at this point in my career, one of the exciting things I get to do is actually be involved in formulating some of those new things, new instruments, new techniques, new
terrific.
ideas of how we should start to advance in the future. So
It's terrific.
it's really, really exciting.
It's wonderful. It's great for your brain. Dr. Beck, if somebody wants to get in touch with you, how can they get in touch with you?
Sure. My office is on Bee Ridge Road. It's Bee Ridge Vision Center, 3920 Bee Ridge Road. And my phone number is 941-923-3411. You can look at our website, www.beeridgevisioncenter.com, or look us up on Facebook. So
And Dr. Beck has a great Facebook. I'm going to just tell you
Okay.
that I've liked her site, and she always has interesting and informative things coming up on there.
Well, we'll have to check
you.
that out. And thank you, ladies, so much for being here. It was a very informative show.
Thank you.
And we'll see you next time on Local
Thanks for
Doctors on
having us.
Call.